The burden of tobacco-related disease and death is rising disproportionately in low-income populations. In 2016, 75% of the deaths that were attributed to non-communicable diseases happened in low and middle-income countries, or LMICs, and many of those are attributed to tobacco-related illnesses. Sadly, because of the pressure from the World Health Organization, as well as privately funded non-governmental organizations, or NGOs, many of these countries are choosing not to regulate safer nicotine products, but instead opting for outright bans, all while they leave cigarettes on the shelves. In May of this year, the Bloomberg-funded tobacco control organization called The Union released a paper called "Why Bans Are Best: Why LMICs Must Prohibit E-Cigarettes and HTPs to Truly Tackle Tobacco." In this paper, the Union lays out 10 arguments as to why they want prohibition instead of regulation for these products. Among those arguments are that these countries are not well-resourced, and therefore they cannot safely regulate the production and sale of these products. Many medical professionals and public health experts do not agree with the union's position. They point to data that suggests that these type of prohibitive policies actually drive people back to dangerous combustible tobacco. However, because of the deep pockets and influence of these NGOs, as well as the lack of their own funding resources, many health authorities take the position of the union incredibly seriously. In fact, some of them have already banned these products at their suggestion. Now millions of people across the world who smoke are faced with the reality that they are viewed as second-class citizens, and they are denied access to the life-changing products that the citizens of high-income countries like the United States, the UK, and many countries throughout Europe actually have. In order to help fight against misinformation and the philanthropic colonialism that the union and other NGOs are perpetrating in these LMICs, we at VIDA News have decided to host a series of panel discussions beginning this week, where we will break down the union's arguments point by point and offer alternative solutions as opposed to outright bans of these safer products. These discussions will be broadcast on the VIDA News social channels, and most importantly, they will feature the voices of those public health experts, medical professionals, and advocates that are in the countries that are being affected by these policies. These are not just voices from around the world, but those that are on the ground, living daily with the consequences, both intended and unintended, of these prohibitive policies. We will also feature thoughts, questions, and feedback from you, the tobacco harm reduction community, as well as from the general public. Our first panel, we will focus on India. And then in the coming weeks, we will highlight these policies and these bans in Central and South America, Southeast Asia, and Africa. And on top of that, we will be releasing additional video content where we will highlight the issues with philanthropic colonialism from a global perspective. We will also talk about the fight for women's rights in tobacco harm reduction and much more. If there are any guests that you would like to see on any of these panels, if you have questions for any of our panelists, or any general thoughts about these topics or regions we are going to discuss, please leave those in the comments below, or you can always email us at hello@vida.news. We look forward to hearing from you, and I look forward to seeing you in the coming days and weeks.